everyone, this is Dr. Ho's Advanced Physical Therapy and Wellness. This is our rockstar PT, Dr. Myro. Alright, today we're going to be covering some hip flexion, some joint mobilization with movements of the joint for hip flexion, hip external rotation, hip internal rotation, even maybe a combination of all the above. So when patients have some femoral acetabular impingement, they're lifting their leg up and they're going, ow, ow, trying to get in and out of the car, and they're like, ow, getting this pinching type pain. Might even be able to get them to do it by just even bringing them into flexion, or even more common, flexion and adduction. So some of the things you can do to work on that, or even if you just feel stiffness right through here where you're like, man, it's super stiff, and can't quite make it to full end range, which is like 120. He's not too terribly stiff with hip flexion. Let's check out external rotation, not bad. Internal rotation, not quite normal. So we'll give him 25 maybe, almost 35. But I'll kind of show you how to do all of them. So the technique is usually just lateral distraction. So you kind of just go way up into the hip, kind of as far as you can, junk out of the way. Good. Belt's just below the hips. And we'll just kind of lateral distract. Doing okay? Yep. Kind of do some lateral distraction right in through there, and then we can work whatever. We can work on hip flexion coming up through here. If he's got that femoral acetabular impingement, and that's not quite getting rid of it, then you can kind of go a little bit more inferior. So lateral distraction slash inferior, and kind of move with him coming up through here. And then same with all the other ones too. You might even go a little bit superior in lateral distraction. It's kind of up to you, kind of up to what best range you're getting, as well as pain modulation effects. You can do external rotation, then you're going to have him move. So we're going to move in external rotation, you move with him, then give him a little bit of assist at the end range. Same with that with flexion too. Have them move first and then assist with a little bit at the end range. And I'll usually do 1 to 3 sets of 10, holding on the 10th one for about 5 seconds. And then let's work on internal rotation. So go ahead and rotate internal. Good. And then I'll assist a little bit. So I'm having him move and then rotating a little bit inward, just like that. And then let's say there's a 10th one. We're going to hold there. 5, 4, 3, 2, 1. Sweet. Cool. And then you can also get creative with them, even doing them in a standing position, sitting on a knee with their chair, just as long as you can laterally distract. Have them like internally rotate, have them step, externally rotate while you're pulling with the band, stepping. And then you can create home exercise programs too, with like the band doing that in the door jam. Even doing that distraction moment, and then lifting the leg that would usually cause them pain with that femoral acetabular impingement. Or even just having it in through there, and then maybe doing like a stretch, leaning forward with that resistance band helping out.